Hey everybody, I hope all is well. I look a hot mess as usual. That's because like I said, when I record these videos, it's really not a recording to look good or whatnot. It's just a recording to give everybody a good update. Sometimes it's going to be a recording about the Lord God. By the way, thank you, Lord God, for just providing for me every day and blessing me. But usually my videos is going to be about me and my health or so on and so forth. But anyway, this video is particularly about what I decided to do with my doctors. Now, this is just an update. What I did was I emailed my doctor's office, the rheumatologist. I emailed them and I told them, hey, look, you guys need to give me a call back so that you could give me my test results. And after that, I don't want to have anything to do with you until I get my blood work complete and done. Not complete and done until I go and see the GI doctor, and then once I see the GI doctor, we figure out what's the plan for the next step. You know, from there, then I'll come back and I'll see you. Um, and I the reason why I decided to do all this is because I'm just I really feel like sometimes doctors, and I don't get me wrong, doctors do what they got to do, and then sometimes doctors just do unnecessary BS. Meaning a doctor can basically do certain things to get to the point, but then doctors can do things that they don't have to do. Now, in my case, I have really severe body aches and pains. So basically, when I went to see the rheumatologist, they did a full blood work, everything that they needed to do, and so they had to do what they had to do, and so some of my blood work came back abnormal. So and then that's what led me up to going to go see the GI doctor. But my thing is this: if you notice that blood work comes back abnormal, then what you need to do is you refer a patient out. You refer that patient back to their primary doctor, and then you tell them, hey, look, I think that they should go ahead and go see this doctor. And then once they see that doctor, then once that doctor confirms it, then they can come back and see me. I don't think that you should be nitpicking anymore, because seeing this particular doctor, this rheumatologist just keeps pushing the issue like over and over, and they are really making me very uncomfortable. They are making me depressed. They are making me lose weight, and mind you, this is the I've been there about 5 times, and every time I go in there, it's the same subject, and I tend to always lose weight every time I talk about this subject, or I get depressed when I talk about the subject. Now, when I just when I let go and I tell them, you know what, look, no, I'm not doing nothing. Forget it. I'm shutting down, and I don't talk about it. Then I start to get happier, and the depression leaves, and you know, but from this point on, you know what I did? I said, I'm giving it all over to God, and I'm gonna let Him handle it, and that's what I did. But I did leave the RA doctor a message, email message. So hopefully she'll give me a call back tomorrow since she's on vacation for the next couple of weeks because she needs to catch up with work. But hopefully someone will give me a call back. But I do know that I'm not going to be going back to her until I can get everything squared away with the GI doctor. On Tuesday, I'm going to be going to get this removed and this on my arm removed. And then there's going to be a couple of more removed. Remember I have NF1. So hopefully they'll remove this on my nose as well. Those are a little irritating. Once again, the doctor's offices call them lesions. They're freaking not lesions. They're moles. You know what I'm saying? So I'm going to have to correct them and tell them, no, they're not lesions. They're moles. So stop calling them that. They're cafe au lait spots. That's what they are. Moles. So I'm getting those removed. And then I go back to my primary doctor on the 16th, which is where I'm going to really let them have it. I'm going to just give them the blues because they sent me to this RA doctor, and this RA doctor really, really has given me hell since I've been to her back in September is when I started going to her. I'm at a point where I don't ever want to go back to her, but I'm going to do what I have to do. And then once I get everything taken care of, then I think I'm going to dismiss her because I want to probably try to find me someone else. Like once I think that's what I'm probably going to do because I just really feel it's not fair that I had to go through all of this crap, and then, cause, seriously, if you guys would just understand where I'm coming from. And I know I'm talking bull crap, and I know that you guys don't want to hear it, but to the people who know where I'm coming from, just kind of like, you can message me if you want to really know the deal and what's going on with me, and I'll be more than happy to tell you. But for the people who go to the doctors all the time, and you got, like rheumatoid arthritis, or you have sarcoidosis, you might have chest pain, you might have fibromyalgia, you might have headaches, you might have migraines, you might have heart pains, you might have anything that might be like really, really, really bad, diabetes, anything. When you're referred out to a different doctor and they begin to play with your health, you start to get angry. So it's almost as if you're like, if you go to your diabetic doctor and your diabetic doctor noticed that you have some type of moles on your skin and they refer you out. No, let's just say you go to your primary doctor and they refer you to a diabetic doctor because they suspect you might have diabetes. But then the diabetic doctor go and do more blood work on you than they should because it's required, and then they find more than diabetes on you, and then they're treating you for more than what they're supposed to be really treating you for. And you're going back and forth to this doctor's appointment, and let's just say you're falling out a lot, but you're not getting treated for it. But you're continuously going back here. But at the same time, you're not getting any type of diabetic medication. But you know for a fact you could have diabetes. What would you do? So that's me. I have this massive, full body ache, like full widespread body ache. My neck all back here. I mean, it. I, it's, it's so emotional. It makes me want to like just literally bust out in tears right now because it hurts so bad. And these people talking about, oh, we want to wait until they say it's okay. I'm so tired. I'm like, well, what are you doing? You know, I take Lyrica. Okay, I take Lyrica. Don't get me wrong. Lyrica works, but it's not really doing the job. It helps a little bit, but it's not really doing the job. You know, so gosh, only people would know. Only people that have full widespread body aches and pains, especially if you get your pain back here. Not to mention, they told me I have scoliosis. And when the PA said I had scoliosis, I was like, oh yeah. My auntie said that it ran on my father's side. She was like, oh, well, that's common. And I was like, you know what? I was like, you say it's common, but it runs on my side of the family, on my father's side. How could you tell me that it's common when it's something that runs on my father's side of the family? Why? And then when I'm asking her about all this stuff that they sent me to go do, these chest x-rays, these x-rays of my hands, these x-rays of my neck, the x-rays of my the throat, the x-rays of my axillary, all that stuff. They she just really was like really not giving them to me. And then to just I don't know. I don't know. So I'm really looking into this. So if she calls, if my doctor from the rheumatologist calls back, because I haven't been, mind you, I haven't been seeing the doctor. I've been seeing her PA because they claim the doctor has been busy. But if my doctor, if the doctor calls me back, I guess I'm gonna go ahead and just bring it up to her, bring it to her attention because it's bothering me. It's bothering me that as a patient that they're playing with me like this. Seriously. Like, refer me out all you want. Don't even refer me out. Give me back to my regular doctor. Tell them that I need to be referred out. When I'm done with being referred out and seeing that doctor, I need to be helped with this pain, you know? But anyway, I know you guys are sick and tired of listening to me. But this is to the people who suffer from body aches and body pains or just want to be heard and are having problems with their doctors as well and being referred out to different types of doctors, and then those doctors that they're being referred to are not really helping them, but yet digging and doing other blood work that is not related to what they really want to go see them for. So if you're having that issue and if you're having those problems, please feel free to contact me. Maybe we can touch bases. Maybe we can talk. Maybe we can even get together and try to solve these problems and see why these doctors are doing this, why these offices are doing this, and why these things are going unnoticed. So you guys have a pleasant night. Thank you for listening, and I'm sorry for just holding up you guys. I just really need people to vent to in times like this because I I just don't know who to turn to, you know, in times like this because nowadays in the medical field it's not about compassion, it's not about empathy, it's not about sympathy anymore. It's about the paycheck. You can't go into the office nowadays and explain yourself and expect for someone to listen. You get up in there and they're rushing you and everything, even the doctors. So you just kind of like got to take it day by day and deal with it on your own and take it as it go. Anyway, you guys have a pleasant night.